Myself, Dr. Sushama Dugad. I am the HOD and the professor of the Dr. Vasantrao Pawar Medical College, Nasik. And I came to this NAPCON 2023 at Delhi. It was organized by the Rakesh Chawla, and I chaired some sessions also. The first session, that is regarding the asthma, acute exacerbation of asthma and how to treat the asthma in the ICU. That is, and second is the acute exacerbation of COPD and how to treat that COPD in the ICU. Means it is the acute exacerbation, but the severity we should know that clinically there are the phenotypes and endotypes of the asthma and COPD. So we have to see the classification, and according to the severity of the disease, we have to treat it. And first we have to monitor the patient according to the ABG also, and if his patient is very hypoxic, then we have to give the oxygen. And if in only the oxygen, if in obstructive airway disease there is hypercapnia also, so we have to treat that hypercapnia with non-invasive ventilator. And if it is not responding, even there is some discussion regarding the non-invasive ventilator and versus the high flow nasal oxygen. And there are different trials also, and they show that high flow nasal oxygen is also useful compared to the NIV. If it is not responding, then you give the NIV, and if there is no response to the NIV, that is a non-invasive ventilator, you give the mechanical ventilation. In asthma, rarely you get the mechanical ventilation, but in COPD also we can manage with the NIV. Now the second part is regarding the pleural effusion. And there are many different types of the effusion fluid analysis. From fluid analysis, we can make out whether it is exudate and transudate according to the Light's criteria. In Light's criteria, but if it is exudate, but there are some cases which are not diagnosed, then we have to do the analysis of the pleural fluid. And pleural fluid, if it is exudate, there are other chances where it is not only the tuberculosis. There are there are some other conditions where you get the exudate also fluid. And like the malignant effusion, also a parapneumonic effusion, we have to differentiate it, and properly we should give the treatment according to the underlying cause of the disease. Then there are some sessions of the ILD also, and the interpretation of ILD, according to the radiological interpretation, is very important. And connective tissue disorder and ILD is the important topic in our India. There are main 7 ILDs, and first most important is the HP, that is the hypersensitive pneumonia. For treatment of the hypersensitive pneumonia, we have to avoid the exposure. And for the other types of the connective tissue disorder, rheumatoid arthritis and CLD and systemic sclerosis, ILD, is also important to give the treatment properly. And there are multiple trials. We have discussed that, and in the trial also, it is the one message that we should not immediately start the antifibrotic drugs. We have to take the proper history, we have to evaluate the patient properly, and then you should, there are some guidelines for the using the antifibrotic agents or some immunosuppressant drugs, and you should not start immediately. This is some messages I want to give you. And this pleural fluid is also analysis is also important. Now, if in pleural fluid we can't make the diagnosis, then thoracoscopy is also very important topic, and we have to do the biopsy of the pleura, and that will give the clue to the diagnosis. We have to, in our India, even it is tuberculosis is more prevalent, but we have to confirm the diagnosis by tissue, and even with the tissue we can diagnose the tuberculosis, and we can send the tissue for the CBNAT, and we can detect the resistance pattern of the tuberculosis by the tissue biopsy. I think it is more sufficient. Okay, thank you.